Hi, I'm Ted Venema. Let's talk about presbycusis, also known as the trouble with treble. Presbycusis is an interesting word. It sounds a lot like the word Presbyterian. Well, that's because they're related. Presbyterian means church of the elders as opposed to the deacons. Presbycusis, hearing of the elders. Presbyopia, your arms aren't long enough to see the page. Presbyopia tends to hit you when you're about 40. Presbycusis tends to hit around age 65. There's lots of things that happen with presbycusis, but the main thing to note is it's the trouble hearing treble sounds. People with presbycusis say, kids mumble today. Everybody's mumbling. I can't hear a noise. I wish people would improve their diction and speak more clearly. Why is this the case? Well, let's look at this figure right here. Presbycusis, high-pitched consonants are difficult to hear. This is called the audiogram. It's a typical hearing test finding from someone with presbycusis. The top numbers here refer to frequencies. This would be low C on a piano, 125 cycles per second or 125 hertz. 250 hertz is sort of like middle C. 500 hertz or 500 cycles per second is high C. So you can see that much of music is really in the lower half of our hearing range when it comes to frequency. But look at how many octaves go higher. And by the way, when you double the number, you've gone up one octave. So 1,000 cycles per second or 1,000 hertz, you're leaving the realm of music. You're getting higher up in treble, 2,000, 4,000, and 8,000. The audiogram is shown here, and the frequency range shows 7 different octaves, from low C all the way out to 8,000 hertz. Now that's way up there in high pitches, and that's where people lose hearing. In fact, babies have hearing way beyond 8,000 hertz. They have hearing past 15,000 hertz. But we don't need that kind of hearing. We lose that as we age. A 10-year-old doesn't have as good hearing as a baby. A 20-year-old's high pitch hearing isn't as good as a 10 years old. So by the time you've hit 65, that high pitch loss has invaded the speech range of hearing. The numbers going down the page here represent decibels. -10 for super sensitive hearing, 0 decibels, 10, 20, and down all the way to 120. So intensity is represented going down, and frequency is represented going to the right. Now the X's and O's represent the left ears is the X's, the O's represent the right ear. Yes, that's right, we play tic-tac-toe. At any rate, normal hearing is when it never takes you more than 25 decibels to just barely hear all of the sounds. Now, when we do a hearing test, we're testing the right ear and the left ear separately under headphones. So we get a measure of the hearing sensitivity across the frequencies. How many decibels does it take to just barely hear the tones? And you can see that this person here has normal hearing for low C because the X and the O show that he could hear the tone at 15 decibels. Remember, the cutoff is about 25. He's essentially normal hearing at 250 hertz. But as we keep going higher up in frequency, we begin to see that the person slides out of the range of normal hearing and drifts down to about a moderate or about a 50 decibel, 60 decibel hearing loss. Some people say percent, but you can see it's about halfway down. At any rate, this person's going to have trouble hearing treble. What does that mean in terms of speech? Well, speech is an interesting sound. Unlike dogs or cats barking or meowing, we are two-legged mammals that walk around flapping our gums, and we have weird speech. We make speech of vowels and consonants. Vowels are louder and lower in pitch, and so are some consonants that use the larynx. Anything that uses the larynx is louder and lower in pitch. So let's look at all these sounds. Z, V, J, M, D, G, and then A, E, I, O, U, and sometimes Y. All of those sounds are ya, la. They're all louder and lower. Okay? Those sounds, this person has no difficulty hearing. But when you start taking the larynx out of these sounds. And you take Z and you take the larynx out of the letter Z, you've got S. When you take a V, you take the larynx out of V, F, you've got F. All these high-pitched sounds, they demarcate the crisp clarity of speech. Think about it. We have 5 or 6 vowels in English. Every word has a vowel. We have thousands of words. Vowels don't tell you what the word is. Vowels just pack up a word and throw it across the street. They give speech its energy, but it's the crisp consonants that define what the word is. Did the person say hat, fat, cat, bat, sat? All the words have but it's the k that defines what the word is. And notice this person can't hear those high-pitched consonants. So he or she is saying, kids mumble these days. I can't tell what they said. I can hear. Don't raise your voice. I don't need you to yell at me. Yeah, no kidding. They got excellent hearing for the low pitches. And when you yell, you're raising up the loudness of your larynx. But they have good hearing there. But what hearing aids need to do is amplify the treble. And that's exactly what we can do today with digital hearing aids. We can selectively amplify specific frequency regions that we need to in order to compensate for the degree of loss that the person presents with. At any rate, it's been a slice talking about the trouble with treble, but it's as common as the day is long and often poorly understood by the public at large. Here's to you. Cheers. Thanks.